Hello everyone and welcome to the third part of non-steroidal anti-inflammatory drugs. In this part we are going to focus on the selective COX inhibitors, which stand for selective cyclooxygenase inhibitors. Talking here about the non-steroidal anti-inflammatory drugs. Again, this slide here represent the medication with a maybe broad background. We are going to speak about three main medication here regarding the selective COX-2 inhibitor. We have Celecoxib, number one. Number two, we have Meloxicam, and number three, we have Etodolac. So three medication will be covered in this selective COX-2 inhibitor. Okay, so this image here or this picture is already presented in the beginning of the NSAID, non-steroidal anti-inflammatory topics, but the main purpose of this picture here to maybe emphasize on the role of cyclooxygenase. Our topic about is COX-2 inhibitor. That means the medication mainly reduce pain and reduce fever and reduce inflammation without any effect on the COX-1. So this our medication mainly inhibit COX-2. So for this reason here, if you can look on the what happened there, so you can see the Celecoxib, for example, mainly inhibit the COX-2 and with no effect with the therapeutic dose, there is no effect on COX-1. And we explain the reason for this one. This medication will be the best medication. Celecoxib will be the best medication for patients suffering from peptic ulcer disease plus low back pain, for example, or patients suffer from peptic ulcer disease and arthritis. So this medication will be the ideal medication for this group of patients. Okay, let us start with the first medication, Celecoxib, the brand name Celebrex. So please remember that the brand name Celebrex and the generic name Celecoxib. Celecoxib with a therapeutic dose, when you prescribe Celecoxib with a therapeutic dose 100-200 milligram twice daily, the Celecoxib will inhibit COX-2 inhibitor 10 to 20 times more than towards like COX-2 compared with the COX-1. So if you can type here, for example, COX-2 more than COX-1. Okay, more than COX-1, it's like relative between the 10 to 20 times more potent. So in this case, we can speak about the selectivity. This medication considered like selective COX-2 inhibitor. This medication could be used for patients from osteoarthritis, rheumatoid arthritis, juvenile arthritis, and ankylosing spondylitis. Available tablet 100 milligram, 200 milligram. Celecoxib considered like less side effect, fewer side effect on the ulcer if you compare with the other group of medication with the NSAID. So that's less occurrence of peptic ulcer disease, or we can speak about less irritation of mucosa, of GI mucosa, less irritation. So Celecoxib considered like less irritation to the gastrointestinal mucosa and this occurrence of peptic ulcer disease compared with the other NSAID. Okay, this is number one. Number two, we have two issues, the important issue we need to address with the Celecoxib. Issue number one here, Celecoxib, the study found in general, the COX inhibitor in general increase risk of myocardial infarction. So in general, this group of medication increase risk of cardiovascular infarction and increase risk of stroke even with the therapeutic doses, especially when you give this medication for patients suffer from underlying heart disease, for example. Okay, here we need to maybe address important issue regarding the selective COX. What happened here, we need to remember important topic here. Okay, we have COX-1 and we have COX-2, and all these coming from one maybe enzyme called COX in general. And this COX responsible for formation of prostaglandin. So this is number one. What they found later on, COX-1 responsible for formation of thromboxane A2. COX-2 responsible for formation of prostaglandin I2. And we know that this thromboxane A2, this is responsible for the, when you activate it, this will lead to the increased platelet aggregation. Okay, and another effect here also vasoconstriction. Okay, on the other hand, we have prostacyclin. Let me clean it a little bit here, make it clear. BGI2 and another name, prostacyclin. Okay, so when you activate COX-2, okay, prostacyclin will be activated. So the result will be here decreased platelet aggregation and vasodilation. Now we can understand what happened here. If you look what we have here, we have opposite effects here. So we have the opposite effect between the thromboxane A2 and prostacyclin I2. So now what we have here, we can imagine now we have this scale, and this is COX, and now we have COX-1 and COX-2. We know that COX-1 responsible for thromboxane A2, and this one responsible for prostacyclin I2. We are good now until this one. So our medication now, we have Celecoxib. So you prescribe Celecoxib to your patient. Okay, we know that Celecoxib will inhibit cyclooxygenase and there's no effect on the COX-1. So what happened here, if you imagine this one, we have the pathway here. So inhibit, so if you have it like this pathway, like two pathway compensatory mechanism, again I tried to mention that like a river with the two branches again, and this is COX-1, this is one here COX-1, and this is COX-2 with the two river. So our Celecoxib here, our Celecoxib inhibit this branch, inhibit our, okay, let me clean this one here again, go back, COX-2. So what happened here, Celecoxib, I'm going to type Celecoxib here, let me do it like this, okay, Celecoxib inhibit COX-1. So the result will be increased activity of COX-1. So increased activity of COX-1, this will lead, if you can look on what we have here, increased activity of COX-1 will lead to the increased platelet aggregation and vasoconstriction. So increased activity of COX-1, green color, increased activity, I prefer to go with the red because it's a risk. That means increase platelet aggregation, and in what else? We have vasodilation. No, we have vasoconstriction. Vasoconstriction here. I will go to the top and look what we have here to remind us. Okay, you can see here, this is the effect of thromboxane A2. The result will be platelet aggregation, risk of clotting, okay, risk of glut, increased risk of clotting here. Okay, so you can imagine now you have patient, and now we have Celecoxib. Now you have patient, let me go with the, okay, you have patient, you have patient come to the clinic, and this patient has a history of angina or hypertension or MI, and this patient suffer from arthritis. We can see it in the practice. Okay, and you as a physician or physician assistant or pharmacist or nurse try to treat him with for example with a Celecoxib. Okay, as you can see here, if you prescribe Celecoxib to this patient, you increase the risk of platelet aggregation and vasoconstriction, and the patient may die from angina or from myocardial infarction. This is the reason we don't recommend to use Celecoxib in patients with a history of cardiovascular disease. I will go back again to the slide. Okay, so here they try to remind us what we have. They said Celecoxib, increased risk of myocardial infarction and stroke, especially in patients with the underlying cardiovascular disease. So we discussed the non-selective COX inhibitor. Another important to the NSAID, maybe drawback or like side last section will be focusing on selective for Celecoxib. They said Celecoxib, the chemical nature of Celecoxib belong to the sulfonamide. And sulfonamide considered the second popular medication in causing allergic reaction. So the first one will be penicillin. The second one on the list will be sulfonamide. Because the chemical structure of Celecoxib belong to the sulfonamide, there's an increased risk of sulfonamide allergic reaction. So two drawbacks regarding the Celecoxib. Number one, increased risk of myocardial infarction and stroke. And number two, because of the chemical nature of sulfonamide, there is a risk of allergic reaction. Okay, next medication here on the left side, we have Meloxicam and the brand name Mobic. Meloxicam is related to the piroxicam. You see the cam here at the end. Oxycam. We have Oxycam, piroxicam, and Meloxicam. So we have derivative from the piroxicam called Meloxicam, relatively selective COX-2 inhibitor, is available 7.550 milligram. This medication indicated for the same osteoarthritis, rheumatoid arthritis, juvenile rheumatoid arthritis. That's good. This medication less side effect on the upper respiratory system compared with the other medication. We have the link here. We can click on the link and read the information about this medication. Okay, if you blink this one here, for example, this is related to the Meloxicam, and I would like to maximize. You can see here on the screen, Meloxicam increased risk of Meloxicam because selective COX. Meloxicam increased risk of cardiovascular disease. The first one in the highlight. Okay, Meloxicam Mobic, and the brand name Meloxicam Mobic tablet. Okay, dosage and it's available 7.5 milligram once daily and 15 milligram once daily. This medication used for osteoarthritis, used for rheumatoid arthritis, juvenile arthritis, and we can use it for 2 years of age and or older. So this is important information about the Meloxicam. Okay, we'll close this one. Okay, so with the link here, they give you more details about Meloxicam or Mobic. Last one on as a selective Etodolac loading. Etodolac mechanism of action. Etodolac like relatively selective COX-2 inhibitor. Etodolac the same indication of action. OA, RA, JRA. Etodolac available 300 milligram twice daily or 3 times. 500 milligram twice daily, or could be 600 milligram daily. So available 300, 600, 500. Etodolac may cause a less side effect as a GI system, fewer side effect. They found in the study Etodolac may cause acute pancreatitis. So one report found that Etodolac may cause pancreatitis, acute pancreatitis. If you click on the link here, okay, I would like to share the article published or like prescription drug information. I type there pancreatitis, and you can see here we have some side effect related to this medication, Etodolac. They said this medication cause peptic ulcer without bleeding, perforation, intestinal ulceration, and pancreatitis. So some article mentioned the pancreatitis for this medication. Okay, so we covered three medication belong to the selective COX-2 inhibitor. We use it for arthritis. At the end of this lecture here, I'm going to share with you like a table, comparative study table to compare between diclofenac, ibuprofen, naproxen, celecoxib, and meloxicam. We look on the effect of diclofenac, for example, here it's inhibit both COX-1 and COX-2. If you look on celecoxib, selective inhibit COX-2. Look on diclofenac, ibuprofen, half-life like 1 to 2 hour, 2 to 4 hour. If you look on the celecoxib, 11 hour. Meloxicam, 20 hour, single dose per day. And what else? We can look on the first pass metabolism, for example, not significant for meloxicam, minimum for celecoxib, and so on. Next slide give you the frequency, dosing frequency. For example, celecoxib once or twice daily, diclofenac 3 to 4 times daily. Because if you go back, diclofenac half-life 1 to 2 hours, so we need to prescribe it very often to the patient, for example. Okay, meloxicam long half-life once daily, naproxen twice daily. If you have extended release naproxen, we can prescribe it once daily. Meloxicam long half-life once daily. Ibuprofen similar to the diclofenac 3 to 4 times daily. This table here or this slide here discusses the risk factor for non-steroidal anti-inflammatory drugs, gastrointestinal complication, who is at risk for developing the peptic ulcer disease, who is at risk for developing complication of peptic ulcer disease or any complication related to the GI system. Number one, any patient above 65 years of old, patient who has history of peptic ulcer disease. If the patient take any other medication such as antiplatelet, anticoagulant, cortisone, SSRI stand for selective serotonin reuptake inhibitor. If the patient suffers from severe illnesses, if the patient suffers from Helicobacter pylori infection, here related to the patient. So we have patient age, history, use of medication, concomitant. Okay, what happened with the class? Which one is more maybe predisposing factor for peptic ulcer? Which one maybe may cause peptic ulcer more than other? They said number one, the medication, non-selective medication may cause peptic ulcer more than COX-2 inhibitor. Indomethacin no more than naproxen. Ibuprofen more than celecoxib. Higher doses may cause peptic ulcer and chronic use. So high doses chronic use maybe cause peptic ulcer. Okay, this is the last slide of non-steroidal anti-inflammatory drugs, NSAID. Okay, this will conclude our lecture about non-steroidal anti-inflammatory drugs. In 3 parts, we cover how the NSAID work. We cover the mechanism of action of NSAID. We cover the effect of NSAID on the GI system, gastrointestinal system, mucosa. We discussed the prostaglandin synthesis. Also, we discussed together the effect of NSAID on the kidneys. Then we brought a group of medication considered like non-selective celecoxib, non-selective cyclooxygenase. Then we have selective cyclooxygenase. We discussed some medication, and the final slide was talking about the complication of gastrointestinal system. For example, some patient, elderly patients, patient with the infection, Helicobacter pylori, or like the patient already on some medication such as anticoagulant, for example. So we have some medication may predisposing to the risk factor for peptic ulcer disease. Again, when you treat patient with the NSAID or with any medication, we need to remember we are dealing with patient, not with the disease, not with arthritis, not with pain. You need to take the patient case in consideration. Does the patient suffer from hypertension, angina, heart failure, or like peptic ulcer disease? You need to take all these variables in consideration. Patient variables, drug history, family history, in consideration before start writing this prescription to the patient or recommend some medication to the patient. At the end of this lecture, thank you so much and have a great day.